Ethical patient care. Objectives. By the end of this presentation, you will be able to discuss the 4 principles of medical ethics. What is ethics? Ethics are the moral principles that determine a person's behaviors. Ethics concerns what's good or bad, or what's right or what's wrong. Ethics in medicine. Ethics in medicine is the cornerstone of a trusting relationship between the patient and their medical providers. Ethics deals with distinguishing between right and wrong while considering all circumstances, such as a patient's cultural or religious limitations. Principles of medical ethics. There are 4 principles of healthcare ethics that improve patient care. The first is autonomy. Autonomy is the patient's right to make decisions about their medical care without their healthcare provider influencing or coercing their decision. For patients to give their informed consent, healthcare providers should educate patients on the risks and benefits of any medical procedure, as well as the likelihood of its success. But providers may not make the decision for the patient. For example, a doctor will recommend to a patient life-saving heart surgery and educate the patient on the procedure. However, it is up to the patient to decide whether or not to proceed. Next is justice. Justice simply means fairness in treatment. In healthcare, justice is the distribution of the benefits and burdens of healthcare, and that should be allocated equally across society in fairness to all. Beneficence is the third principle. It is the provider's intent to do good to the patient to promote the patient's best interest. This is seen when providers prescribe necessary medications, such as insulin for a diabetic. Providers take many training courses and conduct their own research and scholarly writing to continually update their skills and knowledge to ensure they are providing the most appropriate care practices to their patients. Finally is non-maleficence. Non-maleficence is the provider's attempt to prevent injury or illness in patients or others in society. This can be seen when a physician educates patients on hand-washing techniques during COVID, or when a pharmacist administers an influenza vaccine to patients, or even when a phlebotomist uses protective equipment to prevent the transmissions of blood-borne pathogens between patients. Proper standard of care. Providing a proper standard of care to patients is a governed expectation in laws and ethics. Healthcare providers must have a shared commitment and moral obligation to protect all patients from harm.